Every year, nearly 800,000 Americans are struck by a condition that can change their lives forever: stroke. That's one person every 40 seconds. But here's the part that's both tragic and hopeful: many of these strokes don't have to happen. Imagine if your body could send out signals, a month, or even weeks, before disaster strikes. The truth is, it often does. The problem? Too many people don't recognize those signals in time. Stroke can affect anyone, regardless of age, gender, or how healthy you think you are. But early warning signs exist, and if you can spot them and act fast, you might just save a life, maybe even your own. In this video, we'll break down the 7 subtle symptoms that may appear long before a stroke hits. Some might seem harmless at first glance, but they hold life-saving clues. So stick around, and if this message could help someone you care about, don't hesitate to share it. It might be the most important thing they see today. Number 7. Neurological issues. Sudden neurological changes, such as memory loss, dizziness, or balance problems, are not just signs of aging or minor inconveniences. They can be early indicators of a stroke. These symptoms occur when blood flow to the brain's areas responsible for balance, coordination, or memory is disrupted. Even mild changes in your ability to walk, think clearly, or stay steady on your feet could signal serious neurological distress. Pay attention to difficulty walking or standing, frequent falls, or a sudden sense of clumsiness that's out of the ordinary. You might also notice sudden confusion or forgetfulness, where even simple tasks become challenging. In more severe cases, these symptoms can be accompanied by nausea, vomiting, or a spinning sensation, especially in hemorrhagic strokes where bleeding increases pressure on the brain. Strokes disrupt blood flow to critical brain areas, leading to loss of function. For example, if the cerebellum, the brain's balance center, is affected, it can cause dizziness, coordination issues, and instability. Similarly, reduced blood flow to the memory centers in the brain, like the hippocampus, can lead to confusion or forgetfulness. These symptoms are often dismissed as fatigue, dehydration, or even anxiety. But neurological changes, especially when they occur suddenly, are serious and warrant immediate medical attention. They could indicate a transient ischemic attack, TIA, or the early stages of a stroke. Number 6. Speech problems. Imagine trying to speak, but the words don't come out right. You can't form coherent sentences, or maybe you can't understand what someone else is saying. These difficulties, often sudden and unexpected, can be a key warning sign of a stroke. Speech problems, such as slurred speech or trouble expressing yourself, occur when the brain's language centers are affected by reduced blood flow or damage caused by a clot or bleeding. Are you struggling to find the right words? Is your speech slurred or garbled, making it hard for others to understand you? Do you feel like you know what you want to say but just can't articulate it? These are classic indicators of aphasia, which is the inability to understand or express speech, often caused by a stroke. Why do these symptoms happen? When blood flow to areas of the brain responsible for language is blocked or interrupted, those regions can't function properly. This is common in both ischemic strokes, caused by clots, and hemorrhagic strokes, caused by bleeding. Why are speech problems often ignored? Because they can be intermittent or subtle. A person might think they're just tired or flustered, and by the time the symptoms fade, they dismiss it entirely. But ignoring these signs can lead to devastating consequences. Follow the FAST method: face drooping, arm weakness, speech difficulty, time to call 911. Even if speech issues resolve quickly, they could indicate a transient ischemic attack, TIA, or mini-stroke. Seek immediate medical attention to identify the underlying cause and reduce the risk of a full-blown stroke. Speech problems are never just nothing. Acting quickly could mean the difference between recovery and permanent damage, or even saving a life. Number 5. Numbness or weakness in extremities. Imagine waking up one day and finding it difficult to lift your arm or noticing a sudden numbness in your leg. These symptoms might seem minor or even temporary, but they could be your body's urgent alarm that a stroke is on the horizon. Numbness or weakness in the extremities, especially on one side of the body, is one of the most critical warning signs of a transient ischemic attack, TIA, or a mini-stroke. A TIA occurs when blood flow to a part of your brain is temporarily blocked, reducing oxygen supply. This can cause sudden weakness or numbness, often affecting the face, arm, or leg on just one side of the body. It's common to notice additional symptoms like drooping of one side of the face, difficulty lifting an arm or leg, or a tingling sensation. While these symptoms may disappear within minutes or hours, they should never be ignored. Why is this so critical? TIAs don't typically cause permanent damage, but they are a major red flag. They're often called warning strokes because they indicate a high likelihood of a full-blown stroke in the near future. Unfortunately, many people dismiss these symptoms because they vanish quickly, missing the chance to take preventive action. Treat any numbness or weakness as a medical emergency. Even if the symptoms resolve on their own, seek immediate medical attention. This allows doctors to evaluate your condition, identify any underlying issues, and recommend steps to reduce your stroke risk. Early intervention can make all the difference. Don't wait for symptoms to escalate. Your quick action could save your life or prevent severe, long-term disability. Number 4. Severe headache. A severe headache is something most people experience at some point, but what if the pain you're feeling is a sign of something far more dangerous? Sudden, intense headaches can be an early warning sign of a stroke, particularly a hemorrhagic stroke or a brain aneurysm. These headaches occur when increased intracranial pressure builds up due to bleeding in the brain or the rupture of a blood vessel. Is the headache the worst you've ever experienced? Does the pain seem to come out of nowhere, radiating to your neck or face? You might also notice accompanying symptoms like nausea, vomiting, or a heightened sensitivity to light. These signs are red flags, especially if they appear suddenly and without a clear cause. A hemorrhagic stroke occurs when a weakened blood vessel in the brain bursts, causing blood to leak into surrounding areas. This bleeding not only damages brain tissue but also raises pressure inside the skull, leading to intense pain. Similarly, an aneurysm, a bulging area in a blood vessel, can rupture unexpectedly, causing a sudden and catastrophic headache. Common triggers for these events include high blood pressure, which stresses the walls of blood vessels, as well as sudden physical exertion or emotional stress. These factors can cause already weakened vessels to rupture. What can you do to prevent these headaches from becoming life-threatening? Manage your blood pressure through a healthy diet, regular exercise, and prescribed medications if necessary. Avoid overexertion, and learn to recognize patterns in recurring headaches. If you ever experience a sudden, severe headache unlike anything you've felt before, don't wait, seek emergency medical attention immediately. Number 3. Vision problems. Vision problems might seem like a minor inconvenience, but sudden changes in your eyesight could be an early warning sign of a stroke. Your eyes rely on a constant, healthy blood supply to function, and when the arteries supplying blood to your eyes or brain become blocked or narrowed, it can disrupt that flow. This often leads to sudden vision changes, like blurriness, double vision, or even temporary blindness. These symptoms shouldn't be ignored. They could indicate circulatory issues in the brain and may be a precursor to a stroke. Do you notice difficulty focusing, even with your glasses or contacts? Have you experienced a sudden loss of vision in one or both eyes? Maybe you've seen flashes of light or floaters that weren't there before. These changes are often caused by a lack of oxygen and nutrients reaching the optic nerve, sometimes due to an ischemic stroke, the most common type, or a transient ischemic attack, TIA. Why is this dangerous? Vision issues may seem isolated, but they're often the first visible sign of an underlying problem in the brain. If blood flow to your optic nerve is compromised, it's likely other parts of your brain could also be affected, putting you at serious risk. What should you do? Act quickly. Don't assume these symptoms will resolve on their own. Schedule an appointment with an eye doctor or neurologist immediately. If the changes are sudden and severe, seek emergency medical attention. Regular eye exams can also uncover early signs of conditions like hypertension or diabetes, which are major stroke risk factors. Remember, your eyes are not just windows to the world, they're also windows to your health. Sudden vision changes could save your life if you take action in time. Number 2, excessive fatigue. Excessive fatigue is one of those symptoms that's easy to dismiss. After all, we've all felt tired from time to time, whether from stress, a busy schedule, or poor sleep. But what if your fatigue isn't normal? What if it's your body's way of warning you about something far more serious, like a stroke? Persistent fatigue, especially when it's unexplained, can signal reduced oxygen supply to your brain. This often happens when the arteries that carry blood to the brain become narrowed or blocked. Without enough oxygen and nutrients, your brain struggles to function, leaving you feeling drained and exhausted. This type of fatigue is not just a symptom, it's a red flag. In fact, excessive fatigue is sometimes seen in the lead-up to a transient ischemic attack, TIA, also known as a mini-stroke. A TIA is a temporary blockage in blood flow to the brain, often serving as a warning for a full-blown stroke. Are you feeling exhausted even after getting a full night's rest? Do you find it hard to concentrate or stay awake, even when you're not particularly busy? These signs, especially if they're new or unusual for you, should never be ignored. The problem is that fatigue is often chalked up to lifestyle factors like stress, overwork, or lack of sleep. While those are valid causes, unexplained fatigue, especially if it's persistent, requires further investigation. Talk to your doctor or a neurologist, particularly if you have risk factors like high blood pressure, diabetes, or a family history of stroke. Remember, fatigue may feel like a small inconvenience, but it could be your body's way of saying something bigger is wrong. Don't wait, early intervention could save your life. Number 1, persistently elevated blood pressure. High blood pressure, or hypertension, and why it's such a serious warning sign when it comes to strokes. Blood pressure measures the force of your blood pushing against your artery walls. When it's consistently too high, it causes wear and tear on those arteries, much like water eroding a riverbank over time. This constant strain can weaken and narrow your blood vessels, making them more prone to blockage or rupture, both of which can lead to a stroke. Why is this dangerous? First, chronic hypertension can lead to the formation of clots that block blood flow to the brain, causing an ischemic stroke, the most common type. On the other hand, if a weakened blood vessel bursts, it results in a hemorrhagic stroke, where bleeding in the brain causes pressure and damage to surrounding tissue. Both scenarios are life-threatening, which is why managing blood pressure is so critical. How do you know if high blood pressure is silently putting you at risk? Keep an eye out for symptoms like frequent headaches, shortness of breath, or irregular heartbeats. While these might seem mild or unrelated, they could signal that your blood pressure is out of control. The good news? You can take steps today to protect your health. Regularly monitor your blood pressure, especially if you have a family history of hypertension. Simple changes, like reducing salt in your diet, managing stress through mindfulness or relaxation, and exercising regularly, can make a big difference. If lifestyle changes alone aren't enough, talk to your doctor about medications to keep your blood pressure in check. Remember, high blood pressure doesn't always show obvious symptoms, but ignoring it could put your life at risk. If you or someone you know experiences these symptoms, don't wait for them to go away. Seek emergency medical care, even if the symptoms seem minor. Early evaluation can identify the underlying cause and potentially prevent permanent damage or a life-threatening stroke. Your quick action could save a life, or a lifetime of independence. A stroke is a medical emergency that happens when the brain's supply of oxygen-rich blood is suddenly cut off. Without that vital flow, brain cells begin to die in a matter of minutes. But not all strokes are the same, and understanding the difference between them is critical for early recognition, treatment, and prevention. This is the most common form of stroke, responsible for nearly 85% of all cases. Ischemic strokes occur when a blood clot or a buildup of fatty deposits, called plaque, blocks a blood vessel leading to the brain. This blockage stops oxygen and nutrients from reaching brain tissue, causing it to die rapidly and irreversibly. Common causes include atherosclerosis, a condition where arteries narrow due to plaque buildup, and atrial fibrillation, an irregular heartbeat that can create clots which travel to the brain. Less frequent but often more deadly, hemorrhagic strokes happen when a weakened blood vessel in the brain ruptures, leading to internal bleeding. The escaped blood puts immense pressure on surrounding brain tissue, intensifying the damage. These strokes are often triggered by uncontrolled high blood pressure, brain aneurysms, which are balloon-like bulges in weakened vessels, or head trauma. The swelling inside the skull caused by bleeding makes a quick medical response absolutely critical. No matter the type, whether it's a clot or a bleed, strokes are rarely random. They often share a common foundation, a cluster of lifestyle and health-related risk factors that quietly set the stage for disaster. Among the most critical is atrial fibrillation, a condition where your heart's rhythm turns irregular and creates the perfect storm for blood clots to form. High cholesterol adds to the danger by building up plaque inside arteries, narrowing the blood flow. And if you smoke, every puff damages your blood vessels and accelerates plaque formation, speeding up your risk of a stroke. Diabetes also enters the picture, silently hurting your blood vessels and promoting clotting. The more you understand these contributing factors, the more empowered you are to take control, through better blood pressure management, cholesterol control, quitting smoking, and keeping a close watch on your heart's rhythm. And when symptoms appear, even subtly, quick action can make the difference between recovery and tragedy. Stroke prevention isn't about big, overwhelming changes, it's about small, consistent decisions that add up. Start by keeping your blood pressure and blood sugar in check. These two silent culprits, when uncontrolled, can damage blood vessels and make your body a prime candidate for stroke. Work with your doctor, monitor your numbers, and don't be afraid to adjust your medication or habits. Next, aim for a healthy weight. Excess pounds raise your chances of high blood pressure, diabetes, and cholesterol, all of which contribute to stroke risk. Just 150 minutes of moderate movement a week, brisk walks, yoga, or simple strength exercises, can transform your body's resilience. Fuel your body wisely. Choose fresh, whole foods, colorful vegetables, lean proteins, whole grains. Cut back on added sugars, fried foods, and excess alcohol. Every smart bite is an investment in your brain's future. What you choose to eat can either fuel health or feed disease. That's why focusing on fresh, natural foods, like colorful vegetables, ripe fruits, whole grains, and lean proteins, isn't just a dietary choice, it's a brain-protecting decision. On the flip side, foods high in sugar, saturated fats, and alcohol work against you, raising cholesterol and blood pressure, slowly stacking the odds in the stroke's favor. A smarter path? Consider heart-healthy approaches like the Mediterranean or DASH diet, proven to reduce cardiovascular risk. If you smoke, every cigarette is an assault on your arteries, damaging their lining, encouraging clots, and speeding up plaque buildup. Quitting isn't easy, but it's one of the most powerful choices you can make for your brain and heart. Just as important, learn to quiet your nervous system. Chronic stress doesn't just exhaust you, it sends your blood pressure climbing. Simple daily habits like deep breathing, mindful pauses, or quiet walks can bring lasting calm. Your brain does its best healing when you sleep. Aim for 7 to 9 hours of restful sleep each night, not just for energy, but for protection. Finally, don't wait for symptoms to appear. Stay one step ahead by scheduling regular checkups, watch your numbers, track your risks, and act before problems arise. Because in the end, your greatest health decisions aren't made in emergencies. They're made every day, in quiet moments of intention. Own those moments, your future self depends on them. Your body speaks long before a stroke strikes, it whispers warnings in ways we often ignore. But today, you've taken a powerful step by learning what those whispers sound like. This knowledge isn't just information. It's protection. It's prevention. And it could mean the difference between life and loss. Don't let these signs fade into the background of your busy life. Pay attention. Take them seriously. Because one moment of awareness today could rewrite your story tomorrow. If this message moved you, if it made you think of someone you care about, don't stop here. Click subscribe now and join a community that values early detection, real stories, and life-saving insights. Together, we're not just learning, we're building a future where fewer lives are lost to strokes. Stay aware, stay prepared, and above all, stay with us. The next video could be the one that saves a life.